Evening, everybody. Welcome to another live edition of The Breakdown. We're trying some things out this summer for fun. We're going to talk about some of those things, but tonight you're getting an introduction to a new format that we're trying out for the summer because it's too nice to not enjoy a little bit of the outdoors, and putting together the whole 3-hour show every week is just a little bit too much. So we're gonna take it a little bit light for the summer, but at the same time, we still want to bring you a little bit of our typical content because there's still lots to talk about. We also have a big announcement coming up at the end of the show about a little project that we've been working on for a little while. It's going to be all of the awesome. We're very, very excited for that. But tonight, it's July 7th, 2024. The Calgary Stampede is in full swing. As you can see, I'm dressed for the occasion. One of the things you'll find when we're talking about the Calgary Stampede is that the only people who like to dress up for Calgary Stampede are either people who are being paid to do so or people who haven't lived in Calgary for very, very long. After the first couple of decades, it just gets kind of tired. And quite frankly, I got to be honest, growing up in northern Alberta, where I did, you did not see people dressing the way that the people at the Calgary Stampede dress. There's a disconnect there. I've never been able to reconcile it. Not what we're here to talk about tonight, though. We could talk about the Stampede. We could talk about all of the funny little gaffes that all of the politicians have been making. We could talk about all of those things, but we're not. We're here to talk about one thing, because the format that we're going to use for the rest of the summer, we'll get back to the big stupid shows in September, but the format we're going to use for the rest of the summer is going to be, we're picking one thing that's complicated, one thing people should understand better, and we're going to spend the whole show talking about that one thing. And tonight, we picked the most exciting topic that we could think of. We took a look at the world around us in Alberta politics, and we said, what is the most riveting thing that's going to keep people engaged for the half hour, 45 minutes it takes for us to get through it all? What is it going to be? And we landed on dentistry. Because, of course, we landed on dentistry. Look, I hate going to the dentist. I'm sure most of the people, you're listening to this, you hate going to the dentist. Most people hate going to the dentist. They do things that hurt. They try to have conversations with you when your mouth is full of metal and what feels like the business end of a Dyson. It's no fun. You can barely nod, let alone give any sort of a nuanced answer. Nobody likes going to the dentist. But dental health is actually really important. And right now, I know 4 out of 5 dentists are thrilled that we're going to be doing this on the show tonight. But dental health is actually quite important. We're going to talk a little bit about that. We're going to talk about how this relates to Alberta politics. But why is dental health so important? Well, according to the World Dental Federation, oral disease can impact every aspect of life, including personal relationships and self-confidence. It can lead to significant pain, anxiety, disfigurement, acute and chronic infections, eating as well as sleep disruption, and can result in social isolation, loss of work and school days, and impaired quality of life. And it's true when you think about it. Everybody's seen that kid or that adult who just got the braces because they're getting the things dealt with, and somebody tells a really funny joke and they go to laugh or they go to smile, and immediately the hand comes up because they're feeling self-conscious about what's going on in their mouth. So not only does it have significant psychological impacts, but it also has significant physiological impacts. The infections that happen in the mouth can very easily travel to the rest of the body, and that can cause all kinds of other real problems. But that's the broad term. Speaking specifically about Canada, how are things doing in Canada? Well, according to the Canadian Dental Association, and this gets to the core of how easy is it for people to deal with all of the things. 32% of Canadians have no dental insurance whatsoever. 32% of Canadians have no dental insurance. 53% of adults between 60 and 79 years of age have no dental insurance. And 50% of Canadians in the lower income bracket have no dental insurance. So what you should really take away from that is there are a lot of people in Canada who don't have any dental coverage, basically 1 out of every 3. But the people who are impacted are disproportionately lower income Canadians. Now, what's the cost of all of these things? And there is. This is one of the things that was fascinating as we were going through putting tonight's show together. One of the things that we found is there's actually a significant, specific to Canada, economic cost that goes on because of dental stuff, which is mind-blowing. Because you never would think that dental hygiene, dental health has the sizable impact on the economy that it does. But according to the Canadian Dental Association, it's estimated that 2.26 million school days are lost annually due to dental visits or dental sick days. 2.26 million school days lost. It's estimated that 4.15 million working days for adults are lost annually due to dental visits or dental sick days. $4.15 million working days. 4.15 million working days. That is a stunning amount of time where people aren't able to go to work, show up for work because they have dental stuffs to deal with. So to be clear, pardon me, to be clear, dental care is not only important to ensure the prevention of disease, but when disease happens, if it's not addressed early, if it's not prevented, it has massive economic costs. And these are economic costs that aren't just to the individual, but they're also to the organizations or the companies that those individuals are working for. So, what kind of coverage is there to cover people's dent the teeths? There's three major programs. Okay. So obviously there's not three major programs. There's a couple of different options. You can have private insurance. Some people sign up for private insurance out of their own pocket with programs like Blue Cross or any of a number of private health insurance providers who provide dental coverage. There's a lot of organizations and companies that provide dental coverage through those private companies as part of being employed. So lots of employers will pay for Alberta Blue Cross or Sun Life or in order to make sure that their employees stay healthy because, among other things, it costs some money when employees are sick and missing work. And apparently in Canada, we lose 4.15 million working days for dental stuffs. So it makes sense that employers would pay for insurance. One of the other ways, though, is you can access government coverage. And this is where things get a little complicated, and this is why we have to do the deep dive that we're doing here today. So, in Alberta, there are three major programs from the government that provide coverage. The first one is the Alberta Health Benefit. There's a couple other ones. But before we get into the nuts and bolts of all of these programs, there's a couple of numbers that we want to throw at you because they get to be really important really quickly when we're talking about these programs. The first number that we want to throw at you has to do with the average weekly earnings or the average amount that an Albertan makes in a year. According to the government of Alberta, this is the most recent data. We went all the way to the end of the graph. The average Albertan makes $1,330 a week. That means that the average single Albertan makes $69,160 a year. Now, the other number that we need to throw at you has to do with what the estimated poverty line is specific to, and we're going to choose one of the major cities. We're going to say, what is the poverty line in Calgary? Depending on when you look, depending on what metrics you use, you come up with a little variation. But the poverty line in Calgary starts at around $50,000 a year. So the average Albertan really is only $20,000 away from the poverty line. But what that also means is that there's a whole lot of people below that poverty line. But the poverty line is considered to be at around $50,000 a year. And that's where these programs get to be particularly, let's go with nuanced. So the first one that we're going to talk about is the Alberta Health Benefit. It covers low-income adults. But calling it low income is a real understatement because, again, bearing in mind that the average Albertan makes $69,160 a year, bearing in mind that the poverty line is around $50,000 a year, what do you have to make to qualify? What's the maximum income that you as an individual can make to qualify for the Alberta Adult Health Benefit? $16,580. For a single adult looking to get coverage under this program, this is one of the government programs, you're looking at $16,580 a year. If you make more than that, you are not eligible for the government coverage as a single adult for dental care or the other health care things. Now, there are some steps to this as well. If you're one adult with one child, then you can make up to $26,000. If you're one adult with two children, $31,000. One adult, it goes all the way up to four children at $41,957. If you're a couple, so two people, the maximum amount that you can make to be on this program is $23,212. Now, once again, I want to reiterate, the poverty line is set at roughly $50,000. If you are a couple with four children and you want to get dental care for yourself, your spouse, and those four kids from this government program, and you're above the poverty line by even a hair, or if you're just underneath the poverty line by even a hair, you are SOL, because the cutoff for this program is $46,932. If you are two adults with two kids and your family brings in $46,932, you're not eligible for the program. And this is significant because it really does underscore the fact that you have to be the lowest of low incomes in order to be able to access this program. But it's not the only program available. There's also a child health benefit. But when we take a look at what the child health benefit is, the numbers are exactly the same. They just cut off the first line for the one adult, but the qualifying income, if you want to get benefits for your children, is exactly the same. So starting at the lowest eligibility, if you're one adult and you have one child, you cannot make more than $26,023 a year if you want to be eligible for this government program that will cover your health and dental. And if you're a couple with four children, again, a couple with four children, $46,932. So for anybody who's not a senior, who's low income, being below the poverty line as an individual isn't nearly enough. You have to be cripplingly below the poverty line before these government programs can come to assist you. That's really important to understand because when people talk about the generosity that exists, these programs can only be accessed by the lowest income Albertans out there. And it's really, really low. If you do the math, if you divide up a single adult, that's less than $1,500 a month that they would be having to pay all of their expenses with. Now, there is also a seniors program, but you probably won't be too surprised to find out that seniors program also has significant limits. So if you're a single senior, to get coverage, you have to be making less than $33,410. So just take that in for a sec, because as a single adult, you can get coverage at $16,580. As a single senior, $33,410. As a single couple who are seniors, a lot of alliteration going on tonight. If you make as a couple, if you bring in as a couple $0 to $66,820. As long as you as a couple are bringing in less than $66,820, then you can get coverage. If you make more than that, then you get no coverage. And again, these aren't huge numbers. When we're talking about $33,000 a year, that is still $20,000 below the poverty line. And what do seniors get? Well, depending on how you look at it, not very much. Seniors get $5,000 per senior every 5 years, no carryover. So what that means is that seniors get $5,000 that they can spend on their dental care every 5 years. If they spend it all in the first 2 years, if they have procedures that need to be done in the first 2 years, they don't get any other funds to cover any of the other things. That's it. So any preventative care for those last 3 years, out the window. They get $5,000 every 5 years. Now, if you have a senior who's incredibly frugal and they only go for the bare minimum stuffs that they need to do and they end their 5-year period, maybe they got an extra $1,000. Maybe they're saving up because they want to get some bigger work done. No, the money doesn't carry over. That's what the province of Alberta gives to seniors who are low income. Now, all of these programs, it's important to realize, have maximum things that they'll cover. So there's a fee schedule, and that fee schedule determines here's the maximum amount for having a tooth pulled that this program is going to cover. If you want to go get your tooth pulled by the pearl-handed sonic tooth pullers, I'm just making things up now. If you want to go do that and it's going to cost $100 more than the fee amount, then you're paying for that amount out of pocket. So all of these programs have a ceiling for how much they'll cover per procedure. And then you're on your own. Another important thing to realize about all of these programs is the provincial programs, all of those associated fees, are administered by Blue Cross. Now, it's also worth noting that when we're talking about some of these programs, that the provincial health plan, which provides more than the dental stuff, the provincial health plan that's available, that if you don't have low income situations and you want to get benefits, you want to have some health coverage, but you can't afford the full Blue Cross program, there are criteria that you have to meet for that. But also, they don't cover the full amount, and they do charge a monthly premium. So, in a nutshell, if you want to access benefits provided by the province, you have to be really, really poor. And that brings us to the federal program. In December of 2022, the first phase of the federal program was rolled out. That program was pretty limited. And what that program was effectively, it was a $650 per child tax-free payment that was sent out. The second phase is where we are currently. And that's the phase that provides coverage to individuals less than 18 years of age, those over 65 years of age, and those with disabilities. In 2025, the program will be rolled out to everyone who is eligible across Canada. So they're rolling the program out in phases. And of course, there are some eligibility requirements. And we got to talk about what those eligibility requirements are. So to qualify for the CDCP, which is the Canadian Dental Care Program, you must meet all 4 of these requirements. You don't have access to dental insurance. Now, that's private insurance. So if you have access to dental insurance through a company that you work for, then you don't have access to this program. Your adjusted family net income is less than, and this is an important number, $90,000. So if you as a family unit are making less than $90,000, then you're eligible for the program. If you're a Canadian resident for tax purposes, you filed your tax return for the previous year. If you meet those criteria, then you are eligible for the federal program. Now, right out of the gates, we can take a look and we can see there's some pretty big differences. Because for the Alberta program, you can be a couple with 4 children, and if you make $46,933, you're out of luck. With the federal program, it opens that up. It covers more people. Now, there's some other pieces that are important. So talking about that insurance provision where they exclude if you have existing insurance. Just to be super clear, what that means is you don't have any access to any type of dental insurance or coverage through your employers, a professional or students association, your pension benefits or a family pensions benefits, or coverage brought to you by a family member through a group plan. If those things aren't the case, then you're eligible for the federal program. Now, this is important, and it's going to get to be more important as we go through all of the stuff that we need to go through tonight, because there's a lot. But that's the core of what do you get in? What do you need to get into the program? Now, the next question is, what do you get? And that also depends on how much money you make. If you make lower than $70,000 a year, 100% of the healthcare service costs for dentist stuffs will be covered at the CDCP established fees. Again, we're talking about these established fees. We're talking about the statements from the organizations that have said this is how much one of these things should cost. That's the bottom line. This is how much it should cost to have your tooth extracted or have a filling put in or. So the federal program, just like the provincial programs, has those requirements between $70,000 and effectively $80,000. 60% of eligible oral healthcare service costs will be covered. You pay 40%. Between $80,000 and $90,000, the government pays $40,000. You pay 60%, which makes sense. Because again, as we talked about, the people who need access to dental care programs the most are the people who make the least money. So making sure that the bulk of the benefits goes towards the people who can't afford to pay for them themselves the most makes sense. It's something that both the provincial and the federal programs do. They just do them at very, very different levels. But there's some differences that are important to highlight. One of the big differences that's important to highlight is the fact that the federal government makes it very, very easy to find dentists that will only charge you those recommended fees. So once you're on the federal program, it's very, very easy to go to the company that administers the federal program is a private insurance company called Sun Life. They're one of the ones that I mentioned earlier. They're basically just like Blue Cross. This gets to be important later as well. And they have a website where you can look up a registry. You can go through a registry of dentists who have said, yeah, we're going to charge what the fee amount is, so that if somebody does qualify for 100% coverage, they don't have to worry about us offering, hey, do you want the pearl-handed sonic powered teeth removers? That's not going to be part of the menu. They're going to make sure that the people who are coming to see them are people who have understood this is the fee amount. That's that. If you want the extras, you should go to a different dentist, because this dentist is going to provide you exactly what the fees are supposed to be at exactly the level that they're supposed to be administered at. So, to be clear, both the federal and the provincial programs cover a predetermined fee per procedure. They're both administered by private companies. The provincial government, the Alberta provincial government uses Blue Cross to administer their programs by and large, and the federal government uses Sun Life. They both have design features to ensure the programs are targeted to the elderly, the poor, and the disabled. Now, when the federal program expands in 2025, that will expand the eligibility for not just people under the age of 18, people on social services, and seniors. So everybody across the country who makes less than that minimum amount will be able to access these programs. But there's a couple of other features about the federal program that we want to highlight before we get too far into the weeds. And the biggest one is the federal program is very, very clear. They'll work with the provinces to make sure that anybody who has existing social services coverage doesn't get duplicated coverage and they get the most amount of benefit possible. It says it right on their website. If you have dental coverage through government social programs, if you have dental coverage through a provincial, territorial, or federal government social program, you can still qualify for the CDCP. If you qualify, your coverage will be coordinated between the plans to make sure there's no duplication or gaps in coverage. And again, to be crystal clear, these programs are administered by private companies. They're administered by Blue Cross. They're administered by Sun Life. These are companies that are very, very, very used to working with each other because sometimes you'll have a family member who gets benefits coverage through Blue Cross, and sometimes you'll have a family member who gets benefits coverage through Manulife or Sun Life or one of these other places. And they work together to make sure that the coverage works the best way possible. Those mechanisms already exist because this is literally what these companies do for a living. That's the programs. That's the nuts and bolts facts of the programs that are available on either the Alberta provincial government website or on the federal government website. These are facts. These are not up for debate. This is just the reality. Anybody can look them up. But on June 25th, 2024, Danielle Smith sent a letter. She sent that letter to the federal government. And in that letter, she was very clear how displeased she was with the federal program. There's a couple of segments that we want to highlight in particular of that letter to give you really an appreciation of the full scope of what she was trying to say in her letter to Justin Trudeau. So, to start with, Alberta offers the most extensive publicly funded dental coverage in Canada. Now, that may be factually true, but as we've established, the bar is painfully low for people to be able to get to be a part of those programs. In the letter, she claims approximately 500,000 of Albertans benefit from these dental plans, including low-income families and other vulnerable individuals such as children in care. Alberta began offering dental programs in 1973, and since that time has developed the expertise to successfully design, implement, and maintain these much-needed programs. I'm just going to point out again here, Blue Cross administers these programs. The new Canadian dental care plan unnecessarily replicates this coverage for many Albertans. This duplication raises the question of the value of maintaining two plans and whether health funding would be more wisely used to support a single plan. Now, I'm going to pause here to highlight the language because in this letter, Danielle Smith appears to be acknowledging the dental coverage should be part of health care. Alberta has long maintained that it would be more effective to expand existing provincial programs than to introduce a new federal plan. For Albertans, the addition of another dental plan is both complex and confusing. Juggling two overlapping plans and struggling to understand their similarities and difference from a coverage viewpoint is challenging. Eligibility is also a concern. While more Albertans become eligible for coverage under the new federal plan, some Albertans that currently have coverage through provincial programs do not qualify for CDCP. Vulnerable children in care are just one example. Don't worry, we're going to get to that. Healthcare planning and delivery is an area of provincial jurisdiction, and the new federal plan infringes upon this exclusive jurisdiction. So again, Danielle Smith making the clear argument that dental care is health care and should be provincial jurisdiction only. If a new health program was to be developed by the federal government, it should be done in full collaboration with provinces and territories, and discussion should have occurred before these intentions were announced. Unfortunately, this did not occur. Oh, she's angry. She goes on. In consideration of these factors, our government must now decide upon the best approach for Albertans. As such, Alberta intends to opt out of the federal plan and maintain its provincial programs for Albertans. Alberta is seeking to negotiate an agreement for the province's share of federal dental funding and will use this unconditional funding to expand dental coverage to more low-income Albertans. We anticipate our respective officials can negotiate mutually agreeable terms within a 2-year time frame and plan to opt out by 2026. Now, there is a whole lot to unpack there. But before we get to the unpackings, there's a theme that's going on here. And it's a theme that Smith repeated last weekend when she appeared on her radio show, Your Province, Your Premier. We've got 2 clips that we want to play for you.
The National Dental Care Program. What is the reason why?
Well, do you remember when we opted out of pharmacare? And the reason for that is because we have a 5,000 drug plan, and the federal government was proposing a 2-drug plan. And quite frankly, I just couldn't imagine opting for their plan, which would end up being deficient and not covering all of the different types of coverage that was needed. And it's the same story, quite frankly, in dental. Alberta and Ontario are 2 provinces that have been at the forefront of providing dental care. We've been doing it since 1973. So it may well be that the federal government needed to do this in other jurisdictions where they didn't have a program. But we already cover 500,000 people, and I'm not going to kick them off our program for that's been operated since 1973 for a program that's been in place for 5 minutes, because we've already done an analysis of the people who wouldn't be covered under the federal program: children and youth under our guardianship, clients of families with children with disabilities, AISH clients, the Ukrainian evacuees, dependents of AISH clients. We have a whole pile of people that we cover through our program that wouldn't be covered through the Fed. So what we're asking for them is work with us. We have an established program. We have established relationships. We have established payment system. We've mastered the coverage. Work with us, and we can expand the program to more people. And that's what that's the consultation that we've begun. We've said, work with us to expand our plan. Don't try to make us get rid of our plan for yours, because we think ours is better.
And that's the choice. It's either one or the other. You can't have the national program and then have your own provincial coverage. It's one or the other. And what you're saying is, hey, look, for what we can't handle or cover, that's where the national program could have a place.
Potentially, or they could actually work with us to expand our coverage so that we can achieve the same goal. Because why would you want to have 2 sets of administration? I mean, part of the reason for the Canada Health Act and having a single provider is so that you don't end up with duplication when you go through to get payment. And so now you've got a dentist that you're asking to have duplication, not only because they do have a lot of private plans, but our plan, and then in addition to a federal plan. We just think that they've gone down the wrong direction for our province in particular, because we're so far ahead on this, because we offer so much coverage. We have the expertise. They should just piggyback on what we're doing.
That's the first clip. There's a lot to, again, there's always, there's so much to unpack there. But we want to play the second clip just so you can see the consistency of the messaging.
On the dental program, this one says, canceling the dental program does not help my husband, who is 75 years old. My husband was just recently authorized for full coverage for his dental care under this new plan. And now, effective 2026, he'll have to pay out of pocket again. This is crazy that Premier Smith would cancel such a great financial benefit for seniors and low-income citizens. She's doing it because of her extreme dislike, hate of all things federal and Trudeau, without thinking of her own Alberta citizens' needs.
Not true. What we want to do is make sure that we have a transition so that we can have the same objectives met that the federal government wants to, without the duplication and overlap. And importantly, without leaving in the lurch the 500,000 people that we currently cover, many of whom would not be covered under the federal program. I'm sorry, I simply cannot allow for children and for those recipients of AISH and others who would not be covered by the federal program. We're not going to roll our program up. That just wouldn't be a responsible thing to do. People rely on it. They've been relying on it since 1973. We will work with the federal government to expand our program so that that people like the last texter's husband are covered. But it would have been better for them to take that approach in the first place. Work with us on expansion.
And one other text message just basically said that same thing. Premier, I'm a senior widow. The Alberta Dental does not give me the coverage. The federal plan does. If you can give the same coverage as the feds, then everything would be okay.
And that's what we're aiming towards. Absolutely. We just don't want to see a whole pile of money eaten up in administrative expense. And let's remember as well, dentists are telling us that they are frustrated because people show up and expect, oh, they're going to cover 100% of my dental costs at 100% of the cost, and I don't have to pay out of pocket. And they're spending an hour explaining to people that actually in some cases the copayments are as high as 40%. And in some cases the amount of reimbursement is so low that dentists aren't opting into the program. That is going to create an expectation for people that can't be met. And we have to make sure people are getting the care that they need. So yes, happy to work with the federal government to expand our program and ensure more people are covered.
So let's just recap for everybody here what the arguments are that Premier Smith seems to be making, the justifications for wanting to opt out Alberta from the federal dental plan, which, to be clear, there's no mechanism for whatsoever. There's no mechanism whatsoever for Danielle Smith to say, oh, you know what? Hey, we're just gonna opt out of this service that you're directly providing to all Canadians. She appears to be making the argument that, well, you know, it's healthcare, and healthcare is the purview. It's the area of jurisdiction of the provinces. But here's the problem. Dental care is not directly covered under the Canada Health Act. In fact, when you take a look at what the Canada Health Act covers specifically, it covers services that are considered to be critical and that happen in hospital. So there's no existing template that says, oh, you know what, that dental care, that's healthcare, and because of that, it's the jurisdiction of the provinces. If the provinces wanted to assume responsibility for providing dental care for every single person in that province, I have no doubts that the federal government would love it. But the reality is the province doesn't and hasn't made any intention of doing so. So that's the first piece. There's no mechanism by which Danielle Smith can opt Albertans out of this plan. It's just not a thing. As the letter that she wrote says, she hopes that they'll be able to negotiate a situation where Alberta will be able to get unconditional funding for the programs. We'll get into that in a sec. But basically her arguments above and beyond that are it won't cover everyone and everything. There's copay for some income brackets and some fees may still happen. Well, that's problematic because there are copays within the provincial programs. Going back to the seniors program, there are areas where things aren't covered and you do have to have a bit of a copay. So there's the first piece there. You can't say, the federal program, it has copays. Totally unacceptable. Those copays only kick in for people who are making more than $70,000 in adjusted family income a year. Everybody below that doesn't have to worry about the copays. Everything is covered at the fee level, period. She's worried it'll leave people behind. It won't cover everyone and everything. She's very clear that we don't want to see these 500,000 people left behind. The people who are on the current Alberta programs, they would get left behind. It's so tragic. The only way, to be clear, the only way that those people would be left behind is if Alberta decided all of a sudden that they were not going to provide the existing coverage that the province does. Period. As long as Alberta continues to provide the coverage that it does for those on social programs, The federal government makes it very, very clear that they're willing, the companies who are administering these programs will work together to ensure that everybody gets the right amount of coverage. They get the maximal amount of coverage, so everybody wins. That's the bottom line. And in fact, more people would be covered by the federal program with the $70,000 cutoff that are currently being covered by the provincial program. So there's actually a pretty decent argument to be made. Just looking at that fact alone, the province of Alberta could be saving a boatload of money by having the federal government come in and assume responsibility for all of the low income people who are currently receiving dental care. Pretty straightforward. But she talks about some other things. She talks about folks like Aish won't receive the dental care anymore. Well, it's pretty clear, again, referring to the federal government website, if you're on social programs, then it will still cover you. So, not sure where she's pulling that Aish number from. She talks about the refugees, the Ukrainians who have come to Canada and who wouldn't have coverage anymore. Turns into a complicated thing, but as will, I'm sure, be a surprise to nobody, there's already a federal program for that. The Interim Federal Health Program covers health and dental stuffs for refugees, which is perfectly reasonable. Now, there are criteria again, but it's safe to say there always should be some form of criteria, because somebody fleeing from the Ukraine who's leaving with no access to any of their resources back at home, or they've had all of their resources destroyed by the Russians, they're going to need some help. Somebody fleeing Ukraine with $50 million in the bank, should Canadians and Albertans be covering their dental stuffs? I'm inclined to say no. So having those criteria is critically important. But the one that really stuck out, the one that really provoked a particularly strong reaction, at least from me, was when she started to talk about the kids in care, the kids who are under guardianship, because there's some problems there, to say the least. When the first program rolled out in 2022, when the first federal program rolled out in 2022, the one that provided the $650 tax-free payment per kid, guardians of kids were allowed to apply. Pretty straightforward. There is nothing in the federal program that in any way suggests that if you are a guardian of a child, or if you're providing foster care for a child and you're the child's legal guardian through that process, that you can't apply for this program for that child. There's nothing to suggest that's not the case. By every interpretation of the information that's publicly available, we did try to talk to the media inquiry line at the federal government. They didn't get back to us. So, there's jokes to be made about that too, because you talk about own goals. But that's the reality. But when we're talking about kids in care, it's really important to take a look at what the actual numbers are. So we're going to do that for a sec. Because as we were working our way trying to figure out what the hell is Danny on about here, you get to the kids in care piece and it turns into a deeply horrifying rabbit hole. So when we're talking about kids in care, there's a couple of things that are important to understand about the numbers. You can't find out how many kids in care easily, I should say. You can't easily find out how many kids were in care in the province of Alberta in 2021 or 2022, because that's not how the numbers are recorded. The way the numbers are recorded is on monthly averages. And when we start to talk about kids who are receiving care from social services or child intervention services, those numbers get to be really important really quick. because taking a look at the fiscal year of 2022 to 2023, the monthly average number of children and youth receiving child intervention services for placement types, and there's different types of placement. On average a month, there were 1,874 kids who were receiving child intervention services, and they were still living at home. There were 213 in independent living on average per month. There were 182 who were accessing other community resources on average per month. And then there were foster caregivers. And on average per month, there were 3,114 kids receiving foster care. There were 3,126 receiving kinship care. And kinship care is a different thing than foster care. Permanency placements, 128. Campus-based treatments, there were 149. Community group care, 642. Other facility-based placements, 220. And personalized community care, 59. It all varies. It depends on the month. It depends on the time period. All of these numbers ebb and flow considerably. But one of the things that's really important, one of the factors that gets to be really important when we talk about kids who are receiving services from child intervention services is what demographic is receiving it. And is it happening disproportionately? And the answer to the disproportionate question is absolutely. On any given month, 70 to 80% of kids in care are First Nations. Now, those kids should and could receive something called the Non-Insured Health Benefits Program. It's a program that covers exactly this sort of health care need for kids who are status Indians. So that program, wait for it, is a federal program. So 80%, even if we were to go with the argument that all of these kids in care aren't going to receive services from Alberta anymore because Alberta is going to apparently take its ball and go home if the feds bring this program in. Alberta is going to leave these kids and all of these low-income people out in the cold. That is a decision that Alberta is going to make. Even if that's the case, 80% of the kids who are involved with child intervention services would still be receiving services from the federal government through the Non-Insured Health Benefits Program. And this is to say nothing of the Child and Youth Support Program, which provides for financial and medical benefits for a child if the child's parents or guardians cannot care for the child, which is an Alberta program and includes coverage under the aforementioned Alberta Children's Benefit Program, the one we talked about earlier. So the moral of the story is there's a lot of programs out there, and the only way that low-income Albertans and vulnerable Albertans and kids in care get screwed is if the province and the government of Alberta is the one doing the screwing, period. Danielle Smith's threat that these people could not receive coverage is predicated purely and solely on her potential decision to dismantle these programs because of administration costs that the province doesn't even pay for because all of these programs are contracted out to Alberta Blue Cross to administer. It's insanity that she would suggest removing these programs. And it takes a special kind of craven to be willing to roll these kids out in front of this issue to say that these kids wouldn't be receiving coverage when the only reason they wouldn't be receiving coverage is because Danny decided not to. But even then, all of these kids who are in care still have somebody who's legally responsible for them, whether it's a family member, whether it's somebody who's stepped up, or whether it's the actual state. Somebody's legally responsible for these kids for the periods where they're in care. And those people can still apply for the benefits, the federal benefit. That's what's so wild about this. Even if Danny was to pull the plug on all of these programs, which would be a special kind of horrifying. If the province took the time to fill out the applications for these kids, they'd still be covered. There's a couple other things we got to talk about when we talk about Alberta's track record when it comes to kids in care. One of them has to do with the financial management. From an article on a lawsuit that was filed in 2023, the group is arguing it's entitled to money known as the Children's Special Allowances, or CSA, which is meant to match the benefits afforded to kids whose parents receive the Canadian Child Benefit, a tax-free monthly payment made to eligible families. The province of Alberta, by its actions, was essentially using children as a source of revenue to offset its funding obligations of child welfare. So the lawsuit alleges that the province of Alberta was taking those payments to offset the costs of those kids being in care. But that's not the worst part of Alberta's track record when it comes to taking care of kids in care. Because for the last year that we have records for, there were at least 34 kids who died while in the province's care. So I'm not sure where Danielle Smith or anybody from any level of government involved with child intervention services gets off claiming the moral high road when there's very clearly an incredible amount of work that remains to be done. A couple other things that we have to talk about. Danielle says that the federal program has only been in place for 5 minutes. Well, the original program was put forth in 2022. The latest rollout to low-income folks and to seniors and to people with disabilities, that rollout, that's fairly new. That was June 25th. But the rest of it, sorry, not June 25th. I got the date wrong there. But the rest of it is yet to come. But the program itself, the whole reason why it was initiated in 2022 was so they could study how people reacted to it. It's not a program that's only been around for 5 minutes. That's a profoundly disingenuous argument to be made, because it also makes the argument that any government program that is new is clearly not worth doing. And it wouldn't be very difficult to run through a list of impulsive and new decisions that the UCP government has made over the past few years. The Interim Federal Health Program, was the name of the program that covers the refugees or people who are coming from other countries like Ukraine. And it's wild that Danielle would make the argument, hey, we got to take care of the Ukrainians, because she's on video only a couple of years ago saying, hey, it's the Ukrainians' fault because they didn't give back the nukes, even though they had many years prior. The fact of the matter is Danielle Smith is interpreting it as canceling the provincial program. And you have to wonder why. You have to wonder what's going on here. This seems like a gift. This seems like it could save the province a boatload of money, because all of the people who have the low incomes could be transitioned over to the federal program, for the dental stuffs at least. It could save the province a lot of money. The administration costs are costs that are being handled by the respective private companies that administer the programs in Alberta, Blue Cross and Federal Sun Life. But she keeps saying it's about the admin. And it's wild because she also talks about the fact that dentists are having to spend an hour explaining to people how copays work, as if copays are new, as if copays aren't part of some of the provincial programs that already exist. If somebody goes to a dentist under any of the provincial programs that we've talked about tonight, and that dentist charges more than the scheduled fee, that's a conversation that's going to happen anyways. And it's also, quite frankly, a little patronizing to say Albertans are too dumb to wrap their heads around this concept when there's tons of families that have two different adults in those families who have two different health care insurance providers. Again, there are dentists who have signed up for the federal program and who will charge fees that will ensure that there are no costs to the patient. Those are the ones that are available on the website of the company that administers the federal program. She talks about the fact that, there's copays for some. But again, there's only copays for some income brackets. And quite frankly, the most offensive part of all of those clips that we played, the two clips that we played, but they were long, so it felt like more than one clip. The most offensive part is when the host says, you can only have one. That's the problem, right? Like, there could be a place for the federal program if we could have more than one. And Danny says, yeah, possibly, but the duplicate admin. We can have more than one. There's absolutely no reason why we can't. And in this circumstance, as the federal program ramps up, why we shouldn't. That's it. Danny's arguments that this has anything to do with healthcare only hold water if the province of Alberta decides that dental care is an essential service that must be covered by the provinces, because that's how it's decided what's covered. That's how it's decided what the provinces pay for. This dovetails nicely in with the whole argument of, hey, could the province make abortion illegal? No, but they could make it so they don't pay for it anymore. They could delist it as one of those essential procedures. It's the same thing here. They could say any dental procedure in the province of Alberta, we're going to cover it. You know what? We're going to cover it. Hey, federal government, we're going to cover it for everybody. But that's not what Danny has said. What Danny has said is she wants to expand services for low-income Albertans. And it's important to remember where the thresholds are for this program. $70,000, you get 100% coverage under the federal program. $80,000, you got to pay 40%. $90,000, you make $90,000, then you still get coverage, but you got to pay some. It's not unreasonable. What is unreasonable on its face is to say, hey, you know what? We're going to take this program away. And when you start to take a look at it, the only possible explanation for the people that we've spoken to over the last week while we've been trying to put this program together, the only possible explanation is that if the federal government comes in with this program, and it takes over large sections of low-income Albertans, providing them better care, no less, with a program that's more accessible to more Albertans. That program will be managed by Sun Life, which means there's going to be a whole lot of programs that aren't managed by Blue Cross anymore. So at the end of the day, you have to ask the question, is this all just about who's going to administer the program and who's going to make the money administering the program? Because there are literally no other explanations that Danielle Smith or the provincial government has provided that make any sense whatsoever. Literally nothing in her letter about who will and won't get coverage anymore is true. Literally nothing that she said on her radio program that she has since reiterated is true. And the only way that it could be true is if the province pulled the rug out on the few Albertans that wouldn't continue to be covered by the federal program. The UCP's made a lot of fascinating decisions, so it's very, very difficult to swallow the idea that this is about being responsible with taxpayers' money. We saw the same thing this week, where there was a very real prospect that legal aid in Alberta was going to stop being a thing. And the Justice Minister, Mickey Amery, trotted out the exact same argument. Albertans expect government to be responsible with their tax dollars. This is the same government that brought us the war room. This is the same government that's looking at a $100 million trial for the R-Star program that will pay polluters to clean up instead of having polluters pay to clean up. This is the same government that spent $1.5 billion on Keystone. This is the same government that spent $100 million on Tylenol, of which we barely received the amount that we ordered, and that amount is by and large rotting on shelves as we speak. This is the same government that made a corporate tax cut in order to bring in more jobs, but all it did was padded corporations' bottom lines, and it didn't actually create any more jobs. This is the same government that is in the middle of trying to pull off a heritage fund bait and switch where they borrowed money to put money into the Heritage Fund, and now, according to Danny's speculation, are going to be using that money to boost business projects that otherwise have no business case on the open market. This is the same government that lost Albertans billions on the renewables moratorium. It's the same government that made sure that there was a brand new arena, largely paid for by taxpayers, if not entirely paid for by taxpayers, in the city of Calgary. The list goes on. So it's very difficult to believe that Danielle Smith and the UCP would cancel the health coverage for the most vulnerable of Albertans because of fiscal responsibility. What we have seen from all of the things that I've listed off so far is what this government will do is it'll make sure that the right people get paid. And that's what we've got on dentistry. Yeah. Love to hear from you if we hit on something or if we missed something. We spoke to some people in putting this episode together. We want to thank. We can't. This is the weird thing is there's so many people that we can't thank by name because there's so many people who speak to us on conditions of anonymity. But for everybody who has spoken to us over the last 2 weeks, who has either been part of some of these programs that we talked about or has been part of administering some of these programs to provide us with the context and the details, there's been more than a few light bulb moments that have gone on. We want to thank everybody who helped us put this whole thing together because we certainly couldn't have done it in the way that we did it without you. But we're not done yet. Because we got an announcement. We're excited. Oh, this one's going to be good. A little while ago, long while ago, we tried to get somebody on the show, and it didn't work out, and we were very sad because this is somebody whose profile nationally has been building significantly, advocating against things like safe supply. We wanted to have a conversation with them, and we weren't able to make it happen at the time. But friend of the show, Guy Felicella, he's been on a couple times now. He's gotten into a little bit of there's a little bit of an internet turf war. There's the tweet war is going on, and it's going on between Guy Felicella and a gentleman named Adam Zivo, who writes for the National Post and apparently the Western Standard and the Epoch Times. We're very excited to announce we're going to be having an event, folks. It's going to be a corker, as they say, because on July 21st, we're going to be having a roundtable discussion, debate, rumble between Guy Felicella and Adam Zivo. And it's going to be a fascinating little exercise because we're going long. We're going to allow for up to 90 minutes. We have a structure that we'll be using to make sure that nobody wanders off too much. I will be moderating it. We have some folks who are going to be fact-checking in the background, and we're going to be following it up with an episode of fact-checking by some other experts the week later. So we're coming fully prepared to watch and facilitate a conversation between Guy Felicella and Adam Zivo on harm reduction, on safer supply, on the opioid crisis, on the toxic supply, on the political rhetoric. Oh, it's going to be so good. I am so. We've had people asking, hey, would you do like a live roundtable for a while now? And we were toying with the idea of doing something for the NDP debates, but it just got to be way too busy, way too silly, way too quick. So we said, nah, that's not going to work. But July 21st, save the date. 7 p.m. Mountain Standard Time or Mountain whatever time. It's the daylight savings time. Get me, but it's gonna be good. Very excited. This is where I do the plugs because we're going to be taking a short little break on the open mics. We're probably going to do one next week. But to the chat, this will not be a CNN style of moderating. And in fact, there's a good chance that we will not be doing, well, we're going to either try to do an open mic thing next week or we're not going to do anything at all next week because I'm going to be moderating this thing and I got to make sure that I have all of my facts and data and things and stuff in line so that if Guy or Adam wander off, I can rein him back in. So it's going to be, it's not going to be CNN. You're not going to see, there will be no Wolf Blitzer going on or anything like that. This is the part where I do the plugs, though. We're only able to produce the show and continue to generate the kind of content that we do, as well as the kind of content that we're hoping to do because of the support that we get from people either through our Patreon page or that we get through the e-transfers. So we're going to throw a couple things up on the screen right now because if you appreciate the kind of content that we're trying to produce here at The Breakdown, you can sign up to be one of our regular Patreon sponsors at www.patreon.com/thebreakdownab. I assure you, we have looked into this. I know there's people who have concerns about Patreon in Russia. We have looked into this. Patreon is not pro-Russia. Promise. But if you're not a fan of Patreon anyways, and you think, oh, he's just saying that because he wants our money, we've got another way for you to give us money. You can always send, if you don't want to do a monthly thing, or if it's out of your means, then you can do an e-transfer to info@thebreakdownab.ca. We're in the process of saving up for a little bit of a mobile setup that will allow us to cover events mobily and do some other fun things in that regard. So if you have the means to support us, that's cool. But if you don't, we know that there's a lot of people who listen to this show who are on the lower income or disability range of things, and that's okay. Like and share. Smash that subscribe button. Hopefully we don't get kicked off of YouTube tonight for another week. We got kicked off of YouTube for like a week because we were saying that vaccines are good. Vaccines are good. I probably just got us kicked off of YouTube again. And as always, we do have a merch line that we're looking at refreshing, hopefully in the fairly soon future. And you can see that whole merch line at abpoly.ca. And that is it for tonight. Everybody who's hung around in the chat, I want to say thank you. It's good to see you guys back here. Like I'm at the point now. Plain Power coming in with an old reference. We do not. I'm going to be honest. I'll tell you. Inside baseball story for the folks that have listened to this show or followed The Breakdown for any other length of time. When we first started, we did all of our interviews. This was pre-COVID. We did all of our interviews in person. We had like 3 people who helped organize these live shoots. And we had school desks. And the school desk came from one of the very, very first things that we tried to do with The Breakdown. We tried to raise awareness about a high school that was needed in the north end of Calgary. And so we interviewed a city councilor in the desks. We interviewed school board trustees in the school desks. And we had everybody. It became a thing. If you did an interview with The Breakdown, you had to sit in the school desk. And we did that for about 2 years until COVID. And then COVID hit. And I'm not going to lie, the desks got left outside. And it turns out Wood doesn't like that so much. So we had to adapt. But if you go back way back into the Breakdown's back catalog, you'll see the school desks. we also have a puppet that we're going to be bringing forward very, very soon. And I think that's everything. Thank you, everybody, for listening. If you're listening on the podcast version, make sure you leave us a rating and do the stars thing. Because every once in a while, we manage to piss off a government official enough that they come on and they trash talk us. And that's no fun. So let's say something positive or don't say anything nice. And that's it. Thanks, everybody. Stay safe. The next couple of weeks are supposed to be ridiculously hot, and that can have some very real consequences for folks. So make sure that you're staying safe. Make sure you're staying healthy. Enjoy having a little bit of a break over the summer because the next legislative session doesn't start until November, and we're not going to really see the crazy kick in until probably October when all of the horrifying trans policies get announced and everything else. So take a break, enjoy the summer, have some watermelon or a cold beverage, whatever you prefer. We'll be back either next week or July 21st. And in the meantime, keep the conversation going.